Today you will be learning the instrument processing and sterilization. This will prevent cross-contamination within patients in the dental office. When working in sterilization, you'll be working your way from the red end, which is the dirty side, and progress to the blue end to be the clean side for proper instrument processing. Be aware you must be in full PPE for the instrument process for your own protection. This consists of a disposable gown, examination gloves, utility gloves, and a level 3 mask and a face shield. When you have transported your instruments in the sterilization area in the container from your treatment room, enter in the sterilization area, remove gloves, wash hands thoroughly, and re-glove. Check the ultrasonic has the appropriate amount of water. If water is necessary, fill it with the distilled water that is available. Enzyme tablets are stored in a drawer next to the hydrant. An enzyme tablet must be placed into the ultrasonic. At the end of the day, the ultrasonic can be emptied out by the hose in the back, or you can be using the HPE suction hose next to the sink. Keep in mind that while your instruments are in the ultrasonic, hydrum, and the assistina, they are not being sterilized. They are only going through the first few steps of cleaning. Utility gloves must be put on before handling any of the instruments. You don't ever want to handle instruments with examination gloves or barehanded. This could lead to a sharp injury. Remove the cassette from the container as well as any instruments used in the treatment room with caution. Make sure the cassette is in correct order for if excess dental materials, and be aware the cassette for your disposables. You will proceed by grabbing your loose instruments and place them into the ultrasonic. They will be going through a cycle that is 4 minutes minimum. Once you have secured that your cassette is free of disposables, make sure it's securely closed and place it into the hydrum. The cassette will be placed into the hydrum and begin its cycle for 28 minutes minimum. You will place your hand pieces to be oiled in assistina. Make sure they are properly secured. By reassuring they are properly secured, you will prevent them from popping off. Only a certain amount of hand pieces will be able to fit in the assistina. If you have hand pieces that don't fit, place them back in the contaminated area for the next cycle. While everything has been placed in the appropriate cleaning cycles, wipe down your dirty bin you have brought in from your treatment room. When removing items from the ultrasonic, do not place hands in there barehanded. Always have utility gloves on or bring basket out and rinse thoroughly. Instruments retrieved from the ultrasonic are not dry. You must proceed and place them into the dryer. Once you have placed your instruments into the dryer, you will place your basket back into the ultrasonic and securely close the ultrasonic once again. Retrieve your cassette from the hydrum with caution and place it onto the counter. Proceed to unscrew your hand pieces from the acetina and place it on the counter as well. Once everything has gone through the proper cleaning and drying, everything must be packaged correctly. Select the proper sizes in pouches and wrapping. Label your pouches and wrapping paper with the correct information needed. This includes the initials, date, time, and as well as where it will be processed for sterilization, the autoclave or the statum. When placing cassettes or instruments into pouches, locate the indicator or place a small indicator into the pouch. The indicator is a key factor for sterilization. When done placing cassettes, instruments, and handpieces in their appropriate pouches, remove utility gloves and place them in their designated area. You may then proceed to securely seal the pouches. Depending on the manufacturer, paper side will either be up or down, so be aware of the manufacturer's instructions. paper side down for the stratum and paper side up for the autoclave. After placing the pouches into the tray, close it and place back into the stratum. Select the correct sterilization cycle. The water level for the autoclave must be checked frequently as well, and that is filled to the appropriate level. You cannot stack packages on top of each other in the autoclave. The autoclave will either have shelves or racks. This autoclave has shelves and has holes so the packages will be able to go on each shelf. When the autoclave is done with its cycle, it will automatically open on its own, alerting you that it is done. You will then take your pouches from the autoclave and place them into the clean area where they will be stored. The indicators will turn colored, demonstrating that it has gone through the proper sterilization. If in any moment you have any questions on how to properly use a machine, instructions are always located within the top cabinet doors. After sterilization process has been completed, wipe down the area and wash hands after. You may then proceed to remove all protective equipment in its appropriate manner. Everything must be recorded for biological monitoring. Biological monitoring is done once a week. The purpose of biological monitoring is to keep track of records, everything in the sterilization room. If anything were to go wrong, it can be tracked back into the records.